All right, we're here in Calm 2026. Just got done with first day. It was a great day. You had a chance to tell the room full of people about HeadsUp Health and AI and Agentic AI and the potential of everything it's going to be able to do. We had a great panel.
Yep.
It was a lot of fun. How was day one for you?
The energy was just really, really awesome.
Yeah.
I think this is a really unique and interesting time in not just our industry, but in humanity and society as a whole. Yeah. And listening to the people running these AI companies telling us there's a tsunami coming. It's just such an interesting time to even be having these conversations.
Yeah.
So kudos to you, Leonard, for opening the door to the conversations here. I thought it was just an incredibly exciting day.
Yeah, it's interesting because you want to know where everybody's at with AI, right? We have a room full of doctors, medical practitioners, clinics that are focused on longevity medicine, but they can be in different places in their careers. Some are transitioning into this form of medicine, some have thriving practices, but we wanted to kind of ask questions as to where everybody's at. We talked about the fear around AI. A lot of practitioners are worried that they might be replaced by AI. We talked about workflow. We talked about how they can use it personally. We talked about how they can use it clinically. Yep. Where do you think the medical practitioners can use AI, especially with what you're building at HeadsUp Health, like right now?
I would like to think of it as like giving you diagnostic superpowers.
Yeah.
I think the easiest place to start would be using one of the LLMs. Mm-hmm. If you're going to use a version of the public tools, make sure that you upgrade your subscription and turn off the sharing of data so that you can safely put PHI information in there.
Yeah.
Or use a tool like HeadsUp where we can keep it encrypted. I would start by taking some of your hard cases, taking all the data you have on those patients, all their reports, all their labs, everything contextualized, and throw it in there and start using it as a diagnostic assistant and as a hypothesis generator. Yeah. Or use your own data. The biggest lever I took all the reports I'd captured over the last 10 years. And everyone listening as a practitioner, I'm sure, runs tests on themselves as well.
Yeah.
So take your own data and take your PNOE, take your DEXAs, take your blood work, take your genetics, take everything you've got on yourself, wherever it is, Google Drive, find the files.
Yeah.
And put them in and start having a diagnostic conversation on yourself.
Yeah.
I think that is the most powerful place to start. And what you'll realize is very quickly, this is going to give you capabilities that you could have never imagined before.
Yeah.
And that's when the excitement meter goes off the charts for me.
Yeah.
As someone who's been doing this for 15 years, the insights I've gotten on myself just from that one experiment, and then you extrapolate it out to say, oh, wow, I can do this for all my patients now.
Yeah.
And I can do it faster for them and more effectively. So start with yourself.
Yeah, no, I think that's great advice, starting with yourself. It's kind of how we always started. I think you started this company because you started on yourself with a spreadsheet.
It was annoying,
right?
And I started the company.
And that's why you started this company,
Yes.
is you wanted to be able to have track all this data.
Yeah.
And I think that where it's going is different than any other technology that I've ever seen before.
Yes.
Because usually with technology, there's a roadmap, there's a set of rules, there's a set of things that you do. Here, even somebody as advanced as you is saying, hey, upload your information and start asking it questions. It's like an open canvas right now of like what the potential is. One of the things that we've talked about in the past is how we could potentially use what you are building, what you have built with HeadsUp Health, in that we, as a medical education company, as one of the things that we do, is that we're always constantly evaluating literature as it comes in. Yep. And there's brand new literature coming out that's going to impact the way that our doctors treat patients. And now, the way that we can act on that information is just exponentially faster when you have the type of technology that you're building, right? So if a paper comes out recently about the increase in LP(a), if you have low visceral fat, you don't have that amplified risk that we normally see.
Interesting.
Right? And then there's also, if you have elevated LP(a) with elevated waist-hip ratio or visceral adiposity, your hazard ratio is 2.34, I think. It's like you have a much higher risk. So all of a sudden, this one biomarker that we had that we just thought of as having more risk could either have no amplification of risk or a lot of risk. right? And so instead of waiting for each individual patient to come in the door and reevaluate them, now you can take the data set of all of your patients' data and find out in 5 minutes everybody that falls into these two different buckets. 20% of the population has elevated LP(a). So every single practice is going to have a number of patients where your treatment plan is probably going to change with this new data coming in.
Yeah, so the way we would approach that, Leonard, is we would have an agent analyze all the patients in your EHR, look at their LP(a), look at the other biomarkers needed. I think you mentioned body fat.
Yeah, so visceral fat or waist-to-hip ratio. Study was done with waist-to-hip ratio, but a lot of us are measuring visceral fat, which is very similar.
So run a report. This is a simple plain English command.
Yeah.
Pull these numbers on all my patients. If any patients don't have the numbers needed to run the formula, flag those ones so I can go get that information. Then run the assessment based on that data that you've provided. Yeah. And if somebody's body fat is out of range, for example, or out of date, maybe they need to retest. Maybe the last record on.
Yeah, you don't
so
have one,
include the date stamp of the last measurement. Okay, so now in a few seconds you've gone through. For every patient that has the correct data, you've now done that assessment on them. For the ones that need to go provide the information, who to talk to, and you've now trained that agent for every subsequent patient. Always apply this same analysis when you get that data. And then taking it one step further, Leonard, is can we take all the incredible information that's been captured by the brilliant speakers on stage here and make that accessible as well to the nuBioAge network, where you're asking questions of the entire nuBioAge body of information in a plain English language as well.
Yeah, I think that's what's really interesting, and one of the things that I worry about and spend a lot of time is how do we challenge the information that we're getting from AI? How do we challenge the information that we are creating right now?
Yep.
And one of the things that I was saying that we always do, or that I always do, is any lecture or any education that we put together, I actually put it through AI and say, hey, fight back against everything.
Awesome.
Are there any assumptions here? Did we stretch the truth? Did we say something that was just mechanistically valid but not proven?
Awesome.
Right? And then I think that is what we really need to focus on, is because AI can generate so much information. It can generate information that sounds right, but we have to constantly be challenging it. And I think that's one of the questions that I have for you is, how can we trust that the information going into these systems, to these agents, is information that we can trust?
In my personal opinion, that's where the role of the clinician is going to change.
Yeah.
And it's going to change the same way the role of the software engineer is changing. It's no longer necessarily writing all the software, but it's making sure the software written by the AI is technically sound, it's secure, it follows best practice. So the software engineer now is managing agents. And you can imagine a future where clinicians are doing something very similar. Part of that is going to be making sure the recommendations that come back are clinically sound, that what it's providing is properly cited. You can go back and check that citation. And maybe that citation's actually not even the way you want it interpreted, and you have to tune that agent to say, no, we need to interpret this a little bit differently, and you coach it to interpret it differently. I see that is where the role of the clinician will start to evolve more toward.
That makes a lot of sense, because that's already a key point that a lot of practitioners need right now. One of the things that we notice is that the one thing that's holding practices back from scaling either their clinical outcomes or financially is their ability to scale knowledge within their practice,
Absolutely.
Right? How well they can educate other practitioners and staff
100%.
in their practice.
Yes.
And now what you're telling me is that basically it's the same model, it's just we're going to have to do that with agents, right? You're going to have to scale knowledge.
You'll train the agent.
And train the agents within your practice.
And then the agent can consult with any practitioner.
Yeah.
And if a practitioner leaves and you have to bring in a new practitioner,
yeah,
they interact with the agent, and everything is codified inside of that agent.
Wow.
We're talking to companies that have hundreds and thousands of locations.
Yeah.
And they said the number one thing that's holding them back is training the clinician to the protocols and the way the medicine needs to be practiced. And when they leave, someone new has to come in and they start all over again.
Yeah.
And it's the biggest financial risk to these franchises.
Absolutely.
So if we can remove that and have standardized agents that do that work, it can, first of all, ensure more consistency across the way treatment plans are developed. and two, it can remove that training burden as well, and that can lead to significant improvements in efficiency and cost.
Yeah, just listening to this conversation, it's like, how did we get here? You must
We
think this
woke
all
up
the
one
time.
day and it's like in the blink of an eye,
Yeah.
man, this came.
I know. I feel like we're kind of in the twilight zone. Like, are we
Yeah.
really having this conversation right now? This is real life right now? It's just happening so fast. It's
That's why
incredible.
It's so exciting, and I'm an optimist, Leonard. I think that this is going to profoundly improve humanity. I think if there's one industry that needs AI more than anything, because of the complexity, because of the amount of data, because of the limited amount of practitioners that know what you know and know what your speakers know, and we need to make this available to help more people.
Yeah.
That's what I want to work on.
That's exciting, because one of the things that we've always thought about was that, unfortunately, in healthcare, due to regulatory, due to HIPAA, we just haven't had the same access for other industries. Just seem to accelerate faster than healthcare.
Yeah.
Right. Healthcare always seems to be behind because of regulatory and PHI information. But AI and these agents seem to be something that we can accelerate, just like every other industry.
This is now coming top down at the regulatory level. And you have the FDA on board with fast tracking this technology. You have the administration removing the barriers to accelerate the adoption of this technology.
Yeah.
It's the only instance I've seen where healthcare is like, pardon my French, fuck yeah. We need this as fast as possible.
Yeah, no, absolutely, and it's crazy because you usually have, one side of the equation is holding back, that it's going to prevent you. There's usually a bottleneck. But I was listening to a speaker the other day saying that there was a company trying to get specific agents FDA approved.
I think that's absolutely coming.
Yeah.
I think if you look at the state of Utah, okay, the state of Utah is the first state that has changed their state legislation to allow an agent to approve medication refills with
hear about
no
that.
human intervention.
Yeah.
Now they're testing it.
Yeah,
but
yeah. As a pharmacist, all pharmacists, if anybody's listening to it, get nervous right away. Of
it's
course.
refill, okay?
Yeah. Okay.
So it's not the initial prescription.
Yeah.
But like, I don't have to make an appointment. I don't have to wait a week or two to go through that whole process.
Yeah.
I've already been prescribed it, but it's the process of the refill that they're automating.
Yeah.
And that is it's happening now. That's the first instance of an agent approved to do that kind of thing. Now, we're going to need standards, and we're going to need the FDA to publish guidelines. We can't just throw any agent over the fence, and we have to make sure this is done properly. But that's the first example I've seen in the wild at like a state level where this is happening.
Yeah, I think, nobody wants to be left behind. This is something that's happening so fast, it's so potent, that I think everybody's kind of on board, because it's like, you say this all the time, we've both been saying this for a while, AI is not going to replace everybody, but those that don't use AI will get replaced. And I think that's why we see the acceleration with AI.
At HeadsUp, we only hire developers that are AI first. They know how to use those tools.
Yeah.
We're not hiring anyone else.
Yeah, no, it's exciting and scary at the same time, but
I could not agree more.
yeah, I'm glad to have you as a friend to bounce these things off of.
Likewise, brother.
All right, well, thanks a lot, David. It's been a lot of fun.
Thanks, Len. Fantastic event, and we're just honored to work with you and to partner with you.
Oh, of course, it's been great having
Here's
you guys
to continued
here.
success together.
Yeah, for sure.
Thank you.
Thank you.